Hi, I'm Dr. Macy Levan. I'm here with Professor Deans, and I'm going to let her introduce her topic for the TTS 2026 meeting.
Hello, I'm Associate Professor Rebecca Deans. I work for the University of New South Wales and the Royal Hospital of Women. Today, I'm going to speak about setting up a uterus transplantation program. And this is so very important because uterus transplantation is a life-giving, super important organ to transplant, and it sits at the intersection of assisted reproductive technologies and organ transplantation, both of which are great passions of mine.
What makes uterus transplantation uniquely complex compared to other solid organ transplants?
Yeah, absolutely. So there is a myriad of ethical considerations when you consider organ transplantation. Obviously, you've got the right to reproductive, it enhances reproductive rights, and it completely talks to reproductive autonomy and giving that individual an opportunity using the technology we've got in solid organ transplant to then be able to offer that to women who are essentially infertile. And the main reason for them being infertile is that they can't carry a child. They typically have their own ovaries, they produce their own eggs, but unfortunately can't carry that child. And those women really struggle with the pathological process that they have, and therefore, by giving them the opportunity to have an organ transplantation, you are then giving them an opportunity that medicine can help patients with, and that's why it's so very important. In terms of the ethical considerations, there's issues around the donor, whether that donor is a living donor or a deceased donor, and that living donor needs to undergo a very major surgical procedure, which may carry risks associated with it, and that has to be considered ethically. And obviously, you have the considerations ethically for the individual who has been given this great choice but may not fully perhaps understand what that means, the immunosuppression drugs that you need to use in order to keep the transplanted organ in situ. And then you've got to think about the unborn child. So that transplanted organ is going to carry another third party, and the ethical considerations for that individual when they are born. They'll be exposed to immunosuppression agents. And we don't really know, we're still largely under research, so we don't know the long term outcomes of babies born to uterus transplant. So those ethical considerations need to be considered as well.
So let's get to the meat of your talk. So, what were the biggest challenges in setting up a uterus transplantation program? And what advice would you give centers considering developing similar programs?
Okay, excellent. Yeah, well, there certainly are many challenges associated with setting up uterus transplant program. I would say the biggest challenge overall, because you don't have issues with patients' engagement, nor really the community. I think essentially those two groups are really on board. It is getting those doctors on board and getting the teams together. Like any organ transplantation procedure, it involves multiple teams, but uterus transplantation requires even more teams because you're involving reproductive specialists, which don't normally sit within any organ transplantation field. And then you're also involving obstetricians and maternal fetal medicine specialists, as well as obstetric physicians, because of all those possible complications that can occur to the mother and the baby as a result of the pregnancy and having the birth with a transplanted organ. So you can just see that there are multiple teams involved, and they're just medical. You've also got to involve ethicists because it's an ethically charged area, I would say, of transplantation. It's very, many people would call it controversial, and there's no doubt that adds its own barriers and challenges that you need to navigate when you are trying to set up such a program. And of course, you need to be in a centre where they do organ transplantation, they have expertise in organ transplantation, and are able to support you as the leader of setting up this program.
So, we're still in the early stages of uterus transplantation. It's a very kind of new yet evolving space. So, what does the next decade look like for uterus transplantation? And how important is international collaboration in advancing the field ethically and responsibly?
Yeah, absolutely. We are in that the beginning of the curve, I would say, for uterus transplant. And I often try and make parallels to IVF. So when IVF was first being developed in the 80s and 90s, they had quite low success rates. It was very emotive. The doctors who were proposing doing this were touted as the devil, and it was and really, had a lot of dissent from medical authorities and leaders within their own profession and the community. And they just kept at that, they just kept their goal in their sights, and they got through those original challenges to the point now where in Australia, 1 child in every 20 is born as a result of IVF. And the success has exceeded standard spontaneous conception. So if a couple are trying to conceive naturally, they'll have a greater success and a more rapid success by undergoing IVF. So we've seen transformative change in that assisted reproductive technology, and this is just another one. Obviously, there are many surgical challenges that we need to navigate. At the moment, where there's been less than 150 performed around the world. So we're really in the infancy of this technology. But there is no doubt that there is a desire in the community. There is a need for it. We do have the technology and we have the medical know-how. And if we can ensure that all of those goals are aligned, then I think we can really offer something wonderful for patients who are infertile as a result of uterine factor infertility.
So let me just ask a question for those of us who don't really understand. So do you have to use IVF for uterus transplantation?
So for uterus transplantation, we normally do IVF prior to the transplant surgery. And so you have your embryos in storage because often the fallopian tubes are removed as part of the surgery. And therefore you can't conceive naturally. That's the current protocol. We don't know what the future holds because indeed you don't need to remove those fallopian tubes. I think the reasoning for removing those fallopian tubes is that you wouldn't want to get an ectopic pregnancy or something that would compromise their chance of pregnancy. So the current protocols all to use IVF.
Well, thank you. I appreciate you explaining that. So, as you know, one of the TTS sections is the International Society of Uterus Transplantation. And so, what type of abstracts are you expecting to get for the TTS meeting related to reproductive transplantation, program development, or surgical innovation?
Look, I'm really looking forward to the abstracts and those researchers around the world who are interested in this space. And I must admit, the ISUTX that you mentioned, when you go to our individual conferences or we get together, I think because we often face those same challenges, it's a very bonding experience. And we really are a community of friends, I would say. I first met many of these people before COVID, and then my own program had a little bit of a setback. And as with many surgical research trials around the world, had setbacks through that COVID time. But when we came together, it's with an even greater vigor and passion. So there's no doubt we're small, but we're passionate, and we really want to see this work for people. The abstracts, I think that the next phase of development, because there's proof of concept has really been ascertained, and that was by Professor Mats Brandstrom, the doyen, I would say, of uterus transplant, who was able to achieve that first live birth in 2014. But subsequent to that, there's been many babies born. But now, after proving it can work, we want to work on safety and efficiencies and efficacy. So we want to make sure that we have the highest success rate. We want to make sure that we are doing our best for our patients. And therefore, I'm really interested in those, looking at things like, are there complications? What are the complications? And how can we guardrail against those complications or teach each other so that we don't have to learn all of those lessons in various teams around the world. I want to look at immunosuppression regimes and how we can improve outcomes. And I also want to look at things like, excuse me, with my beeping. We want to also look at how we can improve the assisted reproductive technology. So, are the success rates as good as an age-matched woman who doesn't have a uterus transplant if we're doing IVF? And if it's not as good, why is that? Are there ways that we can improve the environment of the uterus? Finally, I think this space lends itself really well in improving IVF because sometimes we have a woman can be born with a uterus, but they can't get pregnant in that uterus, and we really don't know why. And I think that the learnings, the things that we're going to learn from the transplanted uterus and how it responds to an embryo may then translate and improve ART as well. So I think it's such a wonderful cross collaboration of research interests, but that's really what I'm looking forward to seeing at this coming conference.
So, as you know, we have a lot of young researchers that will be at the meeting and are interested in learning from you all. If you had one piece of advice to give the next generation about what rewards and opportunities there are in the field of reproductive transplantation, what would you give them?
Great question. I think my one piece of advice would be to keep going. Don't give up when you're doing any form of research, and particularly if you're doing research in a novel space in the infancy of a technology. There will always be people that want to naysay you or to discourage you. And my main piece of advice really is to keep the faith, keep going, and if you are passionate about something and you think it can work, collaborate, ask for advice, think about other ways that you can get your project off the ground. And I think we're all a community really willing and able to help young researchers. So just reach out anytime.
Well, thank you, Professor Deans. It's been great to speak with you, and we really look forward to seeing you in Sydney in September 2026.